Hi everyone. If you're new here, I'm Dr. Lewis Krenn, board certified family medicine physician. Today, I want to talk about the Delta variant of the COVID-19 virus and vaccine hesitancy, and why, if you're one of the millions of Americans that still has not been vaccinated, but you're at least open to the idea, you might want to get the vaccine sooner rather than later. All right, so I'm going to use my little corner of the world in southwest Missouri as an example of what can happen when the Delta variant, which is the variant of COVID-19 that originated in India, comes to town, and unfortunately you have a low level of individuals who have been fully vaccinated. So in my area, we tend to be a little bit more rural. We tend to be a little bit more conservative leaning politically, and we tend to have more evangelical Christians. Unfortunately, those are the three groups that seem to be more vaccine hesitant. So what has that led to? Well, despite the Delta variant accounting for about 10% of the cases nationwide, what we're seeing locally is unfortunately 90% of our infections are due to the Delta variant. Now, why is this important? Well, it's because the Delta variant, unfortunately, is about 4 times as infectious as the original strain, which means it spreads a whole lot easier. It causes almost twice the severity of symptoms. And most importantly, what we're seeing, and we're seeing this locally, is that the Delta variant causes a much more severe infection in younger individuals. Now, for the last 15 months or so, a lot of what we've seen is individuals in their 60s, 70s, 80s, those with comorbid conditions such as diabetes, obesity, hypertension, lung disease. Those are the people who have been filling up our hospitals to date. Well, with the Delta variant, unfortunately, what we're seeing is younger, healthier individuals show up in our hospitals and ERs. And unfortunately, those are the folks that have been a little bit more emboldened to not take the vaccine because, hey, I'm young, I'm healthy. Even if I get COVID, I'm going to get over it in a few days and then I'm going to go on and live my life. Well, that's not what we're seeing. Unfortunately, we're seeing those teens, 20s, 30s, 40s show up in our hospitals almost on a regular basis now. In fact, our local hospital is almost to the point of having to divert some individuals to other hospitals because we're essentially full in our COVID units and we simply don't have the beds or the resources to take care of these individuals because unfortunately if you're sick enough to end up in the hospital with COVID, you're really ill and you take a lot of intensive care, a lot of manpower to take care of you. And right now, just like every other industry, healthcare is still suffering a shortage in several key areas, including nurses, respiratory therapists, etc. If ever there was a time to consider getting the vaccine, if you're not fully vaccinated, now is the time. We're seeing this in my local area because unfortunately only about 30%, 30 to 38% of individuals in my area have been fully vaccinated. That's much lower than the national average, and unfortunately that's leading to a lot more cases showing up in our area right now. We're surging back to levels that we haven't seen since January and February. I want to talk a little bit about the vaccine, and mostly I want to talk to those of you who might be a little bit hesitant about getting the vaccine, but are at least open to further conversation. And thankfully I've been running into a lot of these lately who is at least open to the idea of the vaccine and maybe for one reason or another just hasn't gotten it yet. Maybe you're, a little hesitant because you thought it was rushed or you wanted to just see how other people have dealt with it. Those are the individuals that I want to talk to for the remainder of this video. So if you fall in that category, I hope you'll at least listen to what I have to say. Now, I'm going to go through some of the common questions that I've been getting asked of people who are a little bit hesitant and hopefully help you make a more informed decision, because ultimately it's still your decision whether you choose to get vaccinated or not. What I have heard recently from one of our local infectious disease doctors, and I think is absolutely true, is you either at this point get COVID or you get the vaccine. I mean, unfortunately, especially in our area where cases are rising astronomically, that's just the reality that we're seeing. So with that, let's talk about some of those questions. First, let's talk about safety. That's one that always comes up. These vaccines are very safe. We've used them in now well over 100 million individuals in the United States and have not seen any serious safety signals that haven't been fully disclosed already. So the two incidents that I'm talking to, one is the blood clots that we saw in the Johnson & Johnson vaccine, and then the other one most recently, there's been some concern that particularly in younger individuals, that the Moderna or the Pfizer vaccines might cause some myocarditis, which is inflammation around the heart. These have been fully investigated, as any reported side effect should, and have been shown to potentially be linked to the vaccine, but are known to be very rare. And I think it's always important to put in perspective the risk of the vaccine versus the risk of getting COVID and what could potentially happen to you. And at this point, the risk of the vaccine is greatly outweighed by the risk of getting COVID. And unfortunately, both of those two side effects that I just mentioned, the blood clots and the myocarditis, can actually happen with COVID, and can happen more frequently with COVID than we've ever seen with the vaccine. So again, very safe, used in 100 million people or more, with very few potential side effects, very few potential severe side effects now. Just about everybody I've talked to gets some level of side effects, whether it's very mild and just your arm gets sore, or you're a little tired, all the way to fever, chills, sweats. But if you think about it, I'd much rather have a couple of hours of those symptoms than days to weeks. Now, let's also talk about this one I got recently, this idea that some people, particularly those who might be more in the Christian faith, are opposed to the vaccines because they were supposedly designed or made with aborted fetus cells. That is actually false. The vaccines were not created with aborted fetus cells. Another question that I get is, if I've had COVID, do I need the vaccine? Currently, the thought process is yes, you should still get the vaccine, because it's felt that the immunity that you get from COVID, particularly if you were sick early on in the pandemic, will not be sufficient to protect you against some of the newer variants. Now, there's still ongoing research on this. We may have a different answer in the future, and frankly, that's just how science works. We go with what we know for now. For now, we know that it is recommended for individuals to still get the vaccine so that you can have a more robust immune response. And actually, there's some thought that you may get a better immune response after having COVID and getting the vaccine than those of us who have just had the vaccine. But again, that's still being researched. Another common concern that I hear is, well, but the vaccine's not 100%. I still might get sick after I take the vaccine. That's true. Unfortunately, nothing is 100%. There's not a single vaccine that we've ever designed that protects you 100% from the disease that we're trying to protect against. But these vaccines are still really good, upwards of 90% effective, even against the new variants. Now, the Delta variant has proven to be a little bit more challenging, and the percentage points have dropped some, but still highly protective. Johnson & Johnson vaccine, maybe not quite so much. I've seen some numbers down in the 60s and 70s from different studies on the efficacy for the Johnson & Johnson. So if you're going to get the vaccine and you have the choice, my recommendation has been the Moderna or Pfizer vaccine. But if you're willing to get the Johnson & Johnson vaccine because you're maybe more convinced with that technology versus the mRNA technology, which is newer to vaccines, then great. My advice to people is get whatever vaccine you're comfortable with. As long as you get something, you're protected, and you're going to help slow down the spread of this virus. That's all that I have for you today. I just wanted to go through some of the concerns and use my local area as an example of what can happen, unfortunately, if we don't get enough people getting the vaccine and some of these new variants show up, which spread much more easily and quicker throughout the community. And we're seeing that right now. And I hope that more individuals in my area will start to take the vaccine. It's extremely available. I tell people at this point, you almost have to try not to get the vaccine because it's available at just about every pharmacy, every health system in the area. And I'm sure that's the case across the United States in most places. I know there's still some trouble getting the vaccine across the world, and hopefully that will improve as well, because we know that we're an interconnected world and we need everybody across the globe to do their part to get this under control. So hopefully through some of the vaccine sharing programs that the international community is setting up, we'll be able to work on that as well. But we know that's still going to be a problem for a while. So heed the warning of my area. If you're interested, look up news stories on Southwest Missouri and COVID right now, because you'll see much more detailed information of what I'm talking about, of what's happening in our area. And I'm hopeful that we don't see a continued surge, but right now it looks like that's where all the data is pointing to, that we're going to continue to surge until we start getting more people to take this seriously. Unfortunately, we've dropped all of our mask mandates. I don't see us going back to that. We've dropped all of our lockdowns. I don't think there's an appetite for going back to that. So the only way that we're going to get out of this is to get people to get the vaccine. So if you're still one of that group that's vaccine hesitant but open to it, please message me in the comments. All right, I hope you've enjoyed this video. Please consider subscribing to my channel. Hit that like button for me, it really helps. And as always, be safe out there.